You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he says nobody should be wearing a loose-fitting denture. He is Connecticut's go-to implant dentist, oral surgeon, Dr. Jordan Greenberg. Dr. Greenberg, welcome to the program.
Thank you, Randy.
Now, I know you brought a stack of photos, so we're going to get to as many of those as possible. But for people that don't know your implant center, like who's the typical patient that you see?
Typical dental implant patient falls into one of several categories. The first category is patients who come in with teeth that are broken down, bleeding gums. They feel like they have bad breath, they're having a difficult time chewing and eating, and don't realize that there is a better way. For these patients, we're able to remove the teeth, place dental implants, and the patient is able to leave the same day with teeth that are screwed onto the dental implants that are not coming out of their mouth.
Okay, now you have a system where they're actually making the teeth on site in your office, is that right? Like printing them, is that right?
We are printing the teeth in the office. We are able to, the same day that the implants are placed, take digital records without that old-fashioned goop, utilize those records.
So the goop that goes in the mouth, that's gone now?
That's gone.
Oh, really?
Oh, yeah.
So it's just like what, like a little camera?
It's a little camera that is used to take pictures, and the pictures are put together as a digital image of your teeth, and we're able to utilize that digital image of your teeth with the placement of the implants to create teeth that are screwed onto the implants the same day. These teeth are printed in the office and you leave the same day with those teeth. The second group of patients are denture wearers. We'd love to see more of these patients. These patients come in, they've been wearing their denture for many years, have sort of become accustomed to it, but don't realize that there's a better way. They've gotten used to taking in and taking out these dentures, but they would love the opportunity to have teeth that are placed on implants and don't need to be removed. And for these patients, most of the time it's a home run, because very often, due to the techniques that we're able to utilize in our office, we're able to place dental implants and have these patients come in with a denture and leave with teeth that are on the dental implants that same day.
Now, if it works out, because we've talked on the phone, that literally on the day of the procedure, a denture wearer could walk in with no upper and lower teeth and walk out that same day with upper and lower teeth that don't come out.
For sure.
Does that happen?
It happens day in, day out.
Now, look, you know, when we talked a little bit about this in the green room, but Connecticut, we think of it as such a healthy place. Are there a lot of people that are either headed to dentures or have dentures there?
Randy, there's probably 600,000 people in the state of Connecticut out of a population of over 3 million people who are either wearing some sort of dentures, partial dentures, or do not have teeth in their mouth.
So why aren't they doing it? Like, why aren't they all coming in?
Because they don't realize that this isn't a possibility. They're scared to go to the dentist. They haven't gone to the dentist, and unfortunately, that's why they are in the situation where they have. They let life take over. They were busy putting their kids through college, taking care of themselves, taking care of their family members. And finally, when they come in and are giving us the opportunity to show them what is possible, they're blown away.
So the denture wearers almost benefit the most?
For sure.
How old can you be to do this? Like, what's the upper range? Like, maybe
there's no age limit. In our office, we've treated patients in their 90s. Those patients are coming in.
So why would a 93-year-old want to do this?
Because she wants to be able to eat. She wants to be able to enjoy life. She's just as frustrated as the 70 or 50-year-old patient who came in, who's frustrated eating, self-conscious when they go out to lunch with their friends. And she just took the initiative to come into the office and find out what the possibilities are. When we hear 70 or 80-year-olds tell us that they're too old for this, that's not the case at all. They're still living day-to-day lives. They're still going out to eat with their friends. They're still going to play tennis. For them, it has just as much of an impact as if you were 40 or 50 having this procedure done.
But are the implants more likely to fall out if you're 80 years old?
Not at all.
So statistically?
Statistically, we have just as good success rates. Over 95% success rates with dental implants being placed.
Now, we talked about denture wearers that could benefit the most of this, but isn't it true if you've been wearing a denture maybe 10, 15 years, you can't do this because you don't have enough bone?
That is not the case at all. We find that they've been told this from their dentist or heard this from their friends that they're not candidates. They do not realize that they do have bone under there, and due to the advanced techniques that we're able to utilize in our office as oral maxillofacial surgeons, we're able to make this happen, and we're able to make this happen in one day.
Now, correct me if I'm wrong, the way dental implants, because I guess you have a unique system going where you do everything under one roof. The way dental implants are typically done is you go to one doctor that does the implant surgery, like the oral surgeon, which is you. Then you go to another doctor's office where they put the teeth on top and then get them maintained elsewhere. You do all three parts. Is that why you do it so quickly?
That's one of the reasons. We used to do it the old-fashioned way, where we would place the implant, the dentist would put the tooth or teeth on the implants, and then a third party would be doing the maintenance of that over time. What we've realized over time is by us being able to do everything under one roof, we're able to control the outcomes, have better success, and really get a better result for the patient.
So you have an in-house lab?
Yes, we've invested heavily in this. This offers us the opportunity to design these cases prior to the surgery, to be able to create guides if necessary for the cases, and to be able to make the teeth in the office.
So you do it on a computer these days?
Oh, everything is done digitally.
Everything's on a computer first?
No more goop.
Okay.
Everything is done, everything is digitally planned, and we're able to orchestrate that digital plan in the office and have the patient leave with teeth the same day.
Okay, now, you have a team, 2 oral surgeons right there. Do you have a bias? Do you think, hey, if I'm going to do this, you should go to an oral surgeon?
You should go to the person who's best at doing this.
Okay.
Whether it's a general dentist who's doing this each and every day, as oral surgeons, we have a wide background in doing this on the most complicated of cases. And in our office, we're doing this multiple days a week.
You say it's life-changing for these patients.
Absolutely.
Okay.
Take a look at this photo.
All right, all right.
This is a patient who came into our office. She had been struggling with bad breath, bleeding gums, unable to eat the food she wanted, a lack of self-confidence. She just wanted a solution. She was going to the dentist regularly. Every time she'd go was because something was wrong.
What was wrong? I mean, what was going on?
Her teeth were breaking down over time. She had fillings that were done years ago. The fillings were coming out of her teeth. She had root canals done. She'd go get a crown on the root canals, and she just started to get frustrated with that whole process.
Is it like a bacterial infection she had?
Oh, she had a terrible bacterial infection. That's what gum disease is. That's why the gums bleed, because there's bacteria that's being festered there.
Okay. So, but if you have bad gums, can you still do this?
Yes, we could definitely do it.
So you clear up the infection?
We clear all the infection, we remove the teeth, we remove all the diseased tissue, and we get down to healthy tissue that we're able to place the implants in with high success rates. Most of our patients don't come in because they had healthy teeth and non-bleeding gums. They came in because they have bacterial infections. Oh yeah. Randy, denture was not an option for her. So
that was one of her options.
Oh, for sure.
Denture. Okay.
It's either walk around like this with the frustrations that she's dealing with every day, the fact that she was self-conscious, she lacked confidence in social situations, going out to lunch with her friends, and she didn't want to go into a denture. She came in looking for options, looking for possibilities. What can I do? Obviously, one of the possibilities always is a regular denture. One of the possibilities for a patient always is a denture that's supported by implants. But that's still a denture. That still is coming in and out.
You mean the snap in, snap out?
Snap in, snap
teeth.
out. It's a denture, though. She wanted something that didn't come in and out. She's in her 40s. She doesn't want dentures for the next 40 to 50 years.
It's looking pretty good.
Oh my God. The self-confidence. Smile from ear to ear. What do you say she looks younger?
She does look a little younger, that's for sure. Even more like...
And she feels younger.
She looks more sophisticated as well. And prettier.
Look, oh my God. The self-confidence is remarkable. Randy, you said she looks prettier. The truth is, everyone looks prettier with teeth.
Just makes you look better.
Of course it does.
Now, eating. Does she have to be careful with certain foods? I mean, once it's healed up, what can she eat?
Once it's healed up, she has no restrictions. During the healing phase, there are some restrictions, but she's still able to eat as much as she was eating with her broken teeth prior.
What's it like when they look at their face for the first time with the new teeth?
Randy, she was in tears. She was blown away. When she let her husband in the room, he was in tears as well. It's life-changing.
Is this one of those things where they say, I should have done this a long time ago?
That's what most of the patients say. But it just takes that leap of faith to come into the office to find out what the options are.
Now you say that when it's all done, they act differently. They look differently, and sometimes you get the wrong impression of them. Could you elaborate on that?
Yeah, because prior to having this procedure done, she was self-conscious. She was frightful in social situations. She didn't want to smile.
She tells you this?
Oh, yeah.
Okay.
She didn't want to smile. Now she could smile. She's proud of who she is.
So what do they like more, like somebody like her? Do they like the way it looks or what they could eat?
I think it's a combination of both. She is able to eat anything that she wants. She's able to go out in social situations. She's at the point of self-confidence where she's taking pictures of herself. She's taking selfies. She's posting online. It's a complete 180.
Now, are there some guys, especially guys, that they don't care how much it looks, but it's more about what they could eat?
Of course.
And then they convert to how much they like to smile.
Oh, yeah. For the guys, a lot of the guys are apprehensive to come in. It takes the wives to push them to come in to find out that there is another option. Oh yeah.
So age doesn't matter. So you could
age does not
matter
at all.
Like if 70-year-olds or 80-year-olds, statistically they're on like 3 or 4 medications. Can they do it even if they're on maybe, let's say, a blood thinner or osteoporosis medications?
Yes.
Or type 2 diabetes medications?
Yes, we are treating patients who are on diabetic medications, who are on blood thinners. We will work with their doctor to regulate those medications prior to surgery, but that does not affect the success rate of these procedures at all. Actually, with diabetics, they're healthier following this procedure because the decreased bacteria throughout their bloodstream that their mouth was contributing to.
So how soon can they eat after it's all done?
They're able to eat the same day that it's done. They're going home that evening able to eat. Obviously, the diet's a bit restricted throughout the healing phase, but they're able to eat that same day. For many of these patients, they're scared to eat a sandwich beforehand because they're scared that when they go bite into that sandwich, their loose teeth or their broken teeth are going to fall into pieces.
They'll come out.
Oh yeah.
Okay. And they tell you this?
They're scared to eat anything beforehand.
Now, we talked about this, that when it's all done, we were joking about it, but the most expensive thing is going out to eat all the time.
Yeah. For them, though, they're able to go out to eat all the time afterwards. They're able to enjoy the foods that they want, where prior to the procedure, they were apprehensive to go out in a public setting and eat because they were afraid that their loose tooth would come out while they're eating any foods.
Okay, good. Now, you have 2 locations, right?
We do.
Where are they?
I have a location in Norwich, Connecticut, and a second location in Branford, Connecticut.
And do you serve people? I mean, does some people drive?
Oh, people drive.
For distances?
People are driving
procedure?
40, 50 miles to have this procedure done. For many of these patients, they had seen dentists or surgeons prior to us or told them that this procedure is not possible.
What about pain? I mean, it seems painful.
It's not a painful procedure. These patients are under intravenous sedation. They are numbed up. They are very comfortable throughout the whole process. Afterwards, they're utilizing some over-the-counter pain medication for the first couple of days. They're sore, but the amount of pain is significantly less than most patients expected. Are they ever surprised?
Like they say, I thought it was going to be worse.
Most people are surprised afterwards because they were expecting it's terrible. And most of these patients, that's what has held them back from going forward and having a procedure like this, is the fear of, is it painful? Am I going to be able to eat afterwards? You know, due to the advanced techniques we're able to use as oral maxillofacial surgeons, this is precision guided surgery. By us having a plan going into the procedure makes the procedure shorter, and the amount of surgery involved is significantly less morbid than...
Okay. Now, because of the IV sedation, I think you told me that they have like no memory sometimes, or very little memory of being there.
They don't remember a thing. It's a pleasant experience. These patients very often are given a Xanax to take before they come in to help relax their nerves. They're put to sleep via intravenous sedation, and they have no recollection.
Now, all of the photos, we were talking about this, that all of these people usually, they don't like their teeth for about 15, 20 years.
Oh, for a long time.
Like it takes forever for them to finally do something about it. Is that right?
Oh yeah, for many of these patients, they don't like their teeth for many, many years, 10, 15, 20 years. The sooner that they are to come in and have a procedure like this done, the better they are.
And they tell their friends. You say sometimes
one
gets it done.
Some of our best referrals are patients' friends, patient to patient, that they never realize that this is an option. You know, they may have had 1, 2, 3 implants placed, and they didn't get the gratification out of having just a couple teeth fixated on implants, and because the rest of their teeth are breaking down, they're still getting root canals, they're still going back having to get crowns, so they're making multiple stops. For the patients, being able to have this all done under one roof is tremendous because they're frustrated. They don't want to continue investing money, investing time.
But you're an oral surgeon, a specialist. Does it cost more to go to an oral surgeon?
No, it probably ends up costing less because we're able to do it all under one roof. Randy, this is another photo.
All right.
Check him out.
Oh, wow.
This is a complete life changer for him. His upper teeth were all sheared off at the gum line.
That's got to be unusual.
It's not unusual. These patients don't smile, so we're unaware that they even don't have these teeth in their mouth.
Okay, so what were his options? Like, what do you do? What's going on?
His options are few and far between. His options are to walk around with broken teeth, with bacteria in his mouth, or to remove the teeth, go into a denture, which for him wasn't an option. He's in his 30s.
So no way he wanted a denture.
No,
okay.
He'd rather keep the teeth broken off at the gum line than have something that comes in and comes out. He's
so
too young for that.
Him? What do you do?
For him, we were able to do this in one day. One day, he came in, he was sedated, we removed the teeth, we removed all the diseased tissue, we placed 6 implants, and the teeth were placed on the 6 implants that same day. Randy, This guy couldn't eat anything. He was limited. He was on a soft diet before we did anything. Following this procedure, he's able to eat anything he wants. He's able to eat steak. He's able to bite into an apple. For him, these weren't possibilities when he had no teeth.
When you have really bad teeth, especially dentures, you say like salads are almost impossible to eat, or little things like almonds or whatever. You can't eat those.
No. You could eat almonds. You could eat salads with teeth fixated on implants.
So anything you could eat with your regular teeth, you could eat.
You could eat with
How
implants.
long can they last?
These are designed to last the rest of your life.
So as long as you kind of maintain
As long
them,
as you maintain them, they're designed to last the rest of your life.
so you just brush them, water pick, and then go see you, what, about every 6 months?
We are going to see us for follow-ups every 6 months to every year. This is another woman who we had the opportunity to treat.
Okay.
She was frustrated. She had been to the dentist. She had done bridge work in her mouth. Everything was falling apart. She just wanted a solution so she didn't have to continue doing stuff and investing money into something that was not working over time.
Because now you're all over the internet. Is that how most of these people find you?
Some of them find us through the internet. Most often it's a referral from either a general dentist or their friend.
So that woman on that before photo, she would have been in a denture. That was one of her options?
One of her options was to be in a denture. One of her options was to stay in the current situation that she was in. I think she had about 6 or 7 teeth. She had no back teeth in her mouth. So even though when she smiles, she looks like she has some front teeth, which she did, she could not chew anything. She was severely limited. She couldn't eat steak.
Now you use the term home run to me. Like, is this one of those home runs?
This is a home run.
Like where you think, boy, this is going to be a big improvement for her.
We could knock this out of the park. She comes in, for her, it could only get better. For us, this is straightforward surgery. This is what we're doing day in, day out.
Look at that after. It looks good. They look natural. Those teeth. They look real.
She is ecstatic. She is thrilled because now she could eat whatever she wants. She goes out to lunch. She smiles. Every time she comes in, she says, "Why didn't I do this 10 years ago?"
Is that right?
For sure.
Now, you're an oral surgeon, but you probably think like the teeth are the most important thing. How important are teeth and gums?
Teeth and gums are everything. You know, our smile is who we are. Our gums are an indicator of our health. If our gums are bleeding with bacteria, that's not healthy.
Okay. You say people with bad teeth are judged.
Definitely.
Unfairly.
For sure.
Oftentimes.
Patients with bad teeth are judged all the time. It's an indicator in movies of people who are poor, people who are homeless.
Okay.
This is not the case. These are everyday people. They just haven't had an opportunity to take care of their teeth, or unfortunately, some of these patients were born missing teeth. This wasn't a choice of theirs. They haven't had the option to get preventative dental care as kids. They don't realize that there is another option. They're used to what they have and they make the best of it. But for them, they're not smiling, they're not living life to the fullest.
And now, do they ever say, because I think you told me, they say, "Doc, you've changed my life."
That's for sure. They've changed their life. They took the opportunity to come in and find out what the options are, and they've made the commitment to go through a procedure like this. So they're the ones. We didn't change their life. We helped them change their lives. Let me show you this next patient.
All right.
He came in, he was numbed up under some sedation, was able to leave with teeth in place the same day.
So what was going on in the before? Because they look pretty good.
They do look good. His gums were bleeding. His teeth were loose. He was scared to go out and eat anything.
So he would have ended up in a denture. Like that's one of his options.
That's one of his options. The other option is to continue suffering.
Okay.
But for him, that wasn't an option. He knew that he was headed towards a denture, but he didn't want to go into a denture. So he came to us to find out if there was any way to place implants. And we said, of course there's a way to place implants. On him, this is one day. He walked in at 8 o'clock. He left at 4 o'clock the same day with the teeth. He's able to eat anything he wants. He's able to go to Outback and eat a steak.
Okay. And can they bite like with their front teeth when they're all healed up, like a raw carrot, or you have to be careful with those kind of things?
You could bite with your front teeth. You could bite with your back teeth. You're able to bite into a sandwich. You're able to tear with your front teeth. You don't need to focus on only using your front teeth or only using your back teeth, which many of these patients were doing prior because they may not have had back teeth or they may have only had front teeth and they were scared that they were going to break those teeth. They're able to eat without restrictions.
Okay. Now we have to bring up the cost thing here for a second because I guess the best dental insurance even does not cover dental implants.
Unfortunately, they don't.
Medicare, Medicaid doesn't really cover it. But you say people finance this, like you have payment plans.
Oh yeah. As long as you have credit, you're able to apply for financing. Patients are able to get a monthly fee that they're comfortable paying and pay it off over a set period of time. And we facilitate that whole process in our office.
So like 80% of your patients might be financing this?
At least.
And this is going on across the country. And this is not just in your office.
No, this is across the country. Most patients cannot pay for this surgery at once. They're utilizing financing, and that's making the payments affordable for them.
Okay, good. Time for some more photos.
Randy, take a look.
All right.
She came in, she had 6 front teeth left. She liked the fact that she had a little gap in between her front teeth. It gave her character.
Okay.
She was worried that she would be lacking that character following us replacing her teeth and placing implants. We told her we can recreate that, and we were actually able to do that on this
So
case.
her teeth were so bad, again, they all had to be taken out.
She had 6 teeth left on top. She had nothing on the bottom. 6 teeth, that's it.
She couldn't eat very well, obviously.
She couldn't eat at all. She was on a soft diet.
Now, on the consult, I mean, do you ever get excited for them? Like,
I get excited
They don't know
because
how good this
they
is
don't
gonna
even
be?
realize how good it's going to be. They have no idea what the outcome's going to be like. They're driven by fear. They're scared. Even if they have the finances, they're questioning whether it's worth it, whether the implants are going to be successful. And we're telling them they're going to be successful, but they don't even want to believe us because they've had such poor experiences in the past with dentistry.
all right. And so with her, what'd you do?
With her, we removed the remaining teeth. She was under sedation, very, very comfortable, completely anesthetized. We placed about 6 implants on top and 6 implants on the bottom. We utilized our digital technology in the office to take all records, and teeth were made the same day, and she left with those teeth that we're looking at in that picture the same day. This case
What was it like for her, by the way?
life-changing. She is, every single time we see her for follow-up, she is beyond grateful. She wishes that she would have done this earlier. Here, take a look at him. He's another one.
All right. Wow.
Frustrated, been seeing the dentist on and off for many, many years.
So guys like this never smile. Like they
He
hide
doesn't
their
smile.
teeth.
We're walking around like this. He doesn't want to smile. He had a partial. He won't even wear the partial because he says it's annoying and doesn't fit him well. He doesn't even realize that for us, this is a home run. Being that he has some teeth, he had a wealth of bone under the surface. We were able to digitally plan this case, utilize conservative techniques, place the implants, take digital records in the office utilizing our technology, and fabricate the teeth in the office. When he woke up, he was thrilled. His wife looked at him and was blown away.
Now, when you say they have to learn to smile again, what do you mean?
They're so used to not smiling. They're used to trying to hide their smile. They're embarrassed. They're embarrassed that their breath may smell. This is all side effects of losing teeth, periodontal disease, and unfortunately, many of these patients, once they're in that process, they don't even go to get cleanings because they think it's sort of hopeless and a waste of money. Here, take a look at this one.
All right.
She in particular came in, she still had the majority of teeth in her mouth. Her teeth were so loose, we could literally wiggle them out. If we had to take a traditional impression to take records, her teeth would have come out in the impression material. We don't use goop in the office. Her records were all taken digitally. None of her teeth had to come out prior to the day of surgery.
Young
Very
to
young.
have this going on.
Very, very young.
Is this just like infection?
Infection, the lack of going to the dentist, the fear of going to the dentist.
Okay.
Fear. It's really sad because she never even knew what the options were. For her, these teeth would be out. She'd be in a denture. She's in her 40s. Denture's
Are there
not
people
an
in
option.
40s in dentures?
Oh, there's people in their 30s and 20s in dentures, unfortunately.
Okay. So with her, again, like 4 or 6 implants?
Same day technique, 4 to 6 implants. We were able to place special implants because she had limited bone. She has a very, very small mouth, and we wanted to be able to deliver to her teeth that went all the way back in her mouth. Not just 6 or 8 teeth in front, but teeth that went all the way back to her molars. So using advanced techniques, pterygoid implants, we were able to place 6 implants in her mouth, and she left with a full set of teeth.
All right. Now, as an oral surgeon, when things don't go right, I think we've talked about, they end up sending the oral surgeon to fix it. Is that true?
It is. Unfortunately, it is true. There's many people who take on these cases who run into complications along the way. And those patients are referred to our office, and we do have to deal with those complications. The beauty of us starting the case is we're able to avoid many of these complications.
Okay.
And if these complications do arise, we deal with them. This is within our skill set. This is what we're used to doing. So it's much better for a patient to see someone who's well-trained in doing this, who's doing this on the day-to-day, not doing 1 or 2 cases a month, not trying to find the least expensive way to get this done. Okay. It's cost effective in our office. By having the technology in the office, we're able to have economies of scale.
Okay, at the top of the show, I said, no more dentures. Do you think this is the future of dentistry? Like dentures as we know them today won't exist?
Dentures aren't going to be
Everybody will get teeth that are attached to implants?
That's the way it should be. And I really hope that's the way it is going forward. Unfortunately, there are many people who don't know that this is an option, who are never given the option of choosing dental implants to stabilize teeth. So they go into dentures, and then they wear those dentures for many, many years, starting at 20, 30 years old. And under those dentures, the bone is slowly resorbing. Unfortunately, those patients sometimes end up at our office, we hope, and we're able to say that even though you may have less bone than you had when you were 20, we still can do this. And that's why it is great when we're able to see these patients before they lose the teeth, before they go into the implants, and we're able to work with them to place implants to avoid that intermediary stage of having the dentures, having a limited diet, not being able to eat, not going out with their friends, being afraid that when they eat lunch, their dentures are just going flopping out of their mouths.
Aside from chewing and eating and compliments
Overall
on their
health.
teeth, but do they start like dating again or getting out more?
Oh, yeah.
Because of this increased self-confidence?
It's a game changer. It's a complete 180. They're out living life again, going out with friends, meeting people, dating, doing all the stuff that they were apprehensive to do. These teeth and the fact that they weren't confident smiling held them back. And for them, it's a life changer. It's pretty impressive.
We're out of time. Okay, so final message to the patients. You say there's two categories. One group that still has teeth, but they have bleeding gums, bad breath, loose teeth. And then the second group are the denture wearers.
Oh, yeah.
That don't even know their options. Let's say that they've heard what you have to say today, but for whatever reason, they're still skeptical. What do you say to them?
Randy, they need to come in. They need to find out what their options are. They're going to either meet myself or Dr. Merriam. We're going to go over the options with them. We're going to explain the procedure from beginning through completion, and we're going to give them the different possibilities.
Okay, and everybody gets sedation.
Everyone gets sedation. On your evaluation, we're going to take a CAT scan so we could evaluate everything that's going on. They will be completely numbed up.
Now, if you had room on your schedule, like let's say somebody watching this, next week they could have their new teeth.
Tomorrow.
Is that right?
It could happen with the fact that we have the digital technology. Openings. With the fact that we have the digital technology, we could do this procedure literally the same day.
Even if they have really bad teeth and gums?
Even if they have really bad teeth and gums. That's what most of these patients are coming in with, bad teeth and bad gums. We're able to remove the teeth, remove the disease same day.
Okay.
As long as we have room on our schedule with digital technology, we're able to do this tomorrow.
To make an appointment, do they go online or just call your office? What do you prefer?
Either one, whatever's easier for the patients. You can call our office at any time. You can call either our Norwich or Branford office, submit an inquiry online.
Okay.
Whatever's easier.
All right. Well, Dr. Greenberg, I want to thank you for coming to the show. Good stuff.
Thank you so much, Randy, for having me.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.